We're learning now, and this is coming from Senator John Thune, one of the Republican leaders, and several of the GOP aides, talking to our Peter Ducey and others, that they are looking at trying to get a health care agreement or something ready by Friday, by which time they would then be able to submit that to the CBO that can rule on this before July 4th as to whether it will be any different than the original measure, which, of course, got a lot of hackles because it would produce 22 million fewer Americans with health insurance. Never mind, more than 20 million more than we have now would have health insurance. At the pace they estimate Obamacare is going, it would not be 42 million. But again, it's still early on here, but they are obviously trying to keep this process moving along to Senate Republican Conference Chairman Senator John Thune. Senator, good to have you. First off, sir, is that accurate? Thanks, that they want some sort of an agreement, or you and your colleagues do, by Friday to submit to the CBO, presumably before the July 4th break?
Right, and I don't think we want to have necessarily an artificial deadline out there, Neil, but we want to use this week and try and get to a conclusion so that we can get this scored by the CBO, and when we come back the week after the 4th, set up a vote. It's time to, I believe it's time to vote. We've got to bring this process to a conclusion and make some decisions and get this across the finish line and on the President's desk.
Do you get a sense, Senator, that this is going to be much more heavy lifting than earlier thought, and winning over, reluctant Republican members, now up to 9, is going to be a much bigger task and maybe not doable at all this summer, that maybe you move on to the tax package and leave this for another day?
I don't know how we can do that, Neil. Clearly we made a commitment to the American people to try and get this done. And yes, we have a number of members who have different concerns that we're trying to address to find that magic 50 votes that we need to move it across the Senate floor. But the alternative really is a very unpleasant one. It means dealing with Chuck Schumer and the Democrats, who have made it very clear what they want to get to is a single payer. And so, you either do this with Republican votes, and we take on the responsibility of trying to fix the mess that the Democrats have created, or we have to try and solve it with Democrat votes, which moves it to the left. And I think our members want to see a solution, not only that stabilizes the markets and brings some affordability to premiums in this country, but also that makes Medicaid sustainable for future generations by giving states flexibility to design their own programs. These are big, consequential wins, and we need to push this thing across the finish line. So I hope that over the course of the next few days here, our leadership can work with the members who have concerns, address those, and try and get us to 50 votes so that we can move forward and then pivot to tax reform and infrastructure and jobs in the economy and all the things that we want to be talking about.
Senator Mitch McConnell had intimated that he'd like to work with Democrats. Democrats have put out this interest in working with Republicans, but of course they have a lot of provisos attached to that. I believe Chuck Schumer had said you got to end this talk of repeal. You've got to cut out all the taxes that you want to see removed in Obamacare. So where is this really going?
I think that's the problem you run into, Neil. If the Democrats have such a different view of this, because they'll want to keep all the taxes for sure. And then they'll want to keep all the mandates, the individual mandate, the employer mandate. Repealing Obamacare is the commitment we made to the American people. We do that when we repeal the individual mandate and the employer mandate, and we repeal the taxes, and we make Medicaid sustainable. Those are all things that, again, if we can get that kind of a bill on the President's desk, that will be a major win. The Democrats are going to be in a different place. If you look at what Chuck Schumer wants and what his party in the Senate wants, they're going to want to keep the taxes, they're going to want to keep the mandates, and they have made it very clear they have no interest in a conversation about how to repeal and replace Obamacare. So those are the alternatives right now.
That's a no on working with Democrats for the time being.
Well, I just don't. I don't see any way we can bridge that divide. I think we have to get this done, and sooner better than later.
Mitch McConnell is speaking on the floor of the Senate right now. I wonder if there's a story that's been circulating in the New York Times. The White House has poo-pooed it, but I wonder what your thoughts are, that most in the Senate, or a lot of Republicans in general, had it working with President Trump, that they say is not really engaged. They prefer working with Vice President Pence, that they'll get more mileage out of that and be able to move the ball forward. Is that true?
Well, both the President and the Vice President have been very involved. The Vice President, of course, is the presiding officer in the Senate. So he's up here. He meets with us on a weekly basis. He's very engaged in the particulars of legislation, and especially right now, health care. But so has the president. I mean, the president's had personal conversations with a number of the members in our conference who have specific issues that he's trying to work through with them.
But, you know, I've heard from people who attended that meeting yesterday, sir, that they were a little alarmed that he seemed slightly disengaged, not really aware of all the details. Now, again, that could be coming from some malcontents who don't flip over him. But is he engaged? Did he seem like he was really in the game here?
I thought he was very engaged, and he's very much about moving the ball down the field and getting a result. You know, whether or not he gets into the weeds on some of the fine points of the legislation itself isn't as important to me as that he understands the broad outlines of this bill, what we're trying to accomplish, how we're trying to rescue people from a failed Obamacare system that has, you know, led to higher costs, higher taxes, and fewer options. And he's very, very committed to getting to a result. And I think ultimately that's what we want him. We want him to do. We want him to be engaged with our members, with the American public about why we need to do this, and to be out there making that sale. And I'm hopeful that as this thing continues to move forward, that he will use the power, you know, the bully pulpit that he has to help us push us across the finish line, and obviously get out there and make the arguments to the American people about why we needed to move to a better way and why the system that we have today under Obamacare is unsustainable and failing the American people.
But just to review that Friday deadline to get something, it doesn't have to be detailed to your point, but something and that you could present certainly to the CBO by the July 4th break. That is true. That is still on.
It's that, you know, that's the plan. Of course, like I said, we want to make sure that we get this done right, but I think it's important for us to start bridging the divides that we have within our conference and figuring out how do we get to 50 so that we can move this thing. I don't think we want this dragging out through the month of July and into August. We know what the issues are. We've got to start making decisions, and we need to start voting.
Okay. Senator Thune, thank you. Very good seeing you again.
Thanks, Neil. You too.